Welcome, everybody. I'm Will Murtaugh. I'm the Executive Director of ACR Health, and I want to thank you all for coming today to Paint the Town Red AIDS Awareness Week, and this is our campaign kickoff, so thank you. From now until Sunday, ACR Health will be everywhere educating Central New Yorkers about how to stop the spread of HIV and inviting them to join us this Sunday at Beaver Lake Nature Center for the 25th Annual AIDS Walk Run. I still can't get over it's been 25 years. These are momentous times for ACR Health on the front lines fighting AIDS for the last 34 years. It seems inconceivable that I could stand here today and actually talk about ending this AIDS epidemic by 2020. Today I can report strong progress in the fight against AIDS epidemic in New York State. AIDS cases reached their highest point in 1993 of over 14,600 in New York State alone. The most recent statistics that we have for AIDS in New York State are from 2015, and the number is now down to 3,123. That is a 79% decrease in HIV infection in 25 years. Give it up to New York, yes. We are making very good progress, but we won't be able to declare ultimate success until we get our numbers to under 750 a year in New York State. That would be a controllable infectious disease if we get less than 750 every year. New York State and ACR Health are making tremendous investments in reducing the HIV/AIDS rate. While we'll talk about the details later, I would like to introduce our guest speakers. Of course, I have here behind me, so sorry not to go in the right order.
On your left.
On my left over here, our Director of Prevention of Community Initiatives, John Arcuro, who's the man in charge of implementing the key elements to ending the AIDS epidemic in upstate New York. We'll also hear from our special guest, Denise Smith, a mother whose son died of AIDS last December. We'll hear her family's compelling story in a few minutes. Thank you, Denise, for being here. And of course, to begin with, I'd like to introduce Syracuse Mayor Stephanie Miner. Mayor Miner has been a long-time supporter of the AIDS Walk Run, she's rolled out the welcome mat at Clinton Square in the town of Syracuse for Paint the Town Red for the past 7 years. Mayor Miner is so invested in the AIDS epidemic campaign, she's formed the mayor's task force to end the AIDS epidemic. Mayor Miner, we are so glad that you are here to Paint the Town Red kickoff for the AIDS Walk Run. Thank you.
Thank you. Thank you all very much. I am happy to have you here in City Hall today. I want to say just a couple of things. For those of us who have known people who have been infected with HIV or died of AIDS and are old enough to remember when it was seen as an incurable plague, we never thought that this day would come, where we could have within our sights the idea to say that we can end the AIDS epidemic. That doesn't happen unless you have a committed group of people around you willing to make that a priority. And we have been so fortunate in this community to have AIDS community resources be able to keep that focus on this so that we could get to this point. We have all realized through AIDS community resources and through our own experiences and members of this community that fear is a terrible, terrible thing, and particularly when it comes to disease. What we have been able to do in this community through partnerships and friendships and working together is to remove fear and to say to people that together we can end this epidemic if we work together. And so today we are here to celebrate having within, on the horizon, ending the epidemic, working together. We all had a part in doing this, but I think most importantly and most profoundly, to celebrate the fact that the Syracuse community is a place that says fear has no role in public health. And we will not stand by and allow that to be a demagogue or scapegoat people for what is a public health issue. So I want to end with where I began, thanking all of you for being here, thanking all of you for everything that you have done day in and day out to remove fear, to move forward towards solutions, to recognize the humanity in each of us, and to, most importantly, make this community a better place with all of your hard work. So thank you all very much.
Thank you, Mayor Minor. I hope you all know this, but Mayor Minor, for your work to end the AIDS in Syracuse. We can't thank you enough for your hospitality here at Clinton Square. Well, we're in the City Hall, but for the past 7 years, she's allowed us to come into town and spread the AIDS awareness big time. So we'd like to express our heartfelt gratitude to you for helping us paint the town red. Kickoff happen every year. You've been a dedicated partner in the fight against HIV and AIDS. In 2015, she created the Mayor's Task Force to End AIDS, bringing together 21 AIDS service agencies to strategize how to end AIDS epidemic here in Syracuse. You have helped the HIV prevention message reach a wide audience, and for that I am personally and the professionals at ACR Health are eternally grateful. Thank you, Mayor. You get a hug for that. So next on, there are 3 parts to the New York State strategy to end AIDS in New York State. We first have to get people with HIV into treatment and keep them there. We then have to encourage, and we should encourage other people to be using PrEP, the 1 pill a day that can keep HIV away. And we also, and central to the whole process, is identifying people who have HIV and don't know it. We now turn to our next speaker, John Okura, ACR Health's Director of Prevention of Community Initiatives, who oversees our HIV testing program, and John will explain a little bit about this process. Thank you.
Thank you, Will. Good morning, everyone. We really appreciate you being here with us this morning. Together, with your help, we can really, truly end this epidemic. This morning, I wanted to stress that HIV is preventable. People who don't know they have HIV are the ones who spread it. And these are the people that ACR Health is working hard to find, which is why it is so crucial to this epidemic that everyone know their status. In 2015, Onondaga County reported 34 newly diagnosed HIV cases and 25 newly diagnosed AIDS cases. These new incidences represent the lives of 34 people whose infections could have been prevented through education and testing. ACR Health is at the forefront of HIV prevention, and in the past 5 years, we've increased testing by 45%. We are committed to providing counseling and testing to everyone who needs it, including many marginalized populations who experience healthcare inequalities, like injection drug users, men who have sex with men, Black and Latino Americans who have been disproportionately affected by HIV and AIDS since the epidemic's beginning. ACR Health understands that this is largely due to injustices in the healthcare system and a lack of access to care, and we are here for you. I just want to repeat that. ACR Health is here for you. We offer confidential testing without judgment that takes less than 10 minutes, and there's nothing to be afraid of. If you receive a positive result, our team will work tirelessly to connect you to services and provide you with all the tools you need to manage your health. But you can't get treated if you don't know, and you can't let fear stop you from finding out and taking control. This is a painless way to do your part to stop the spread of HIV. Our next speaker is a very brave woman named Denise Smith, who has selflessly offered to share the story of her son Ronnie, who died late last year of AIDS. His family learned that out of fear, he had never been tested for HIV.
Good morning. It's an honor to be here today. December 5th, 2016, I laid in bed with my son, singing in his ear to comfort him while he was dying. He will be forever 32. In August of 2013, Ron was working a full-time job. He loved his job, he loved his coworkers, often volunteered to work 40-plus hours. By the middle of August 2013, Ron was ill. Disoriented, trouble walking, urine retention. He's taken out of work for a week with the diagnosis of a UTI and Norwegian scabies. This went on for 3 weeks. My husband and I then brought him to upstate emergency room, where they ran a battery of tests and came up with a diagnosis of AIDS. We had no idea what this meant for him, but we knew we were going to hold his hand and fight the battle with him. I want to talk about stigma. Webster's New World Definition. A bad mark on one's record, a sign of disgrace. Because of stigma and fear, my son did not get tested. Because of stigma, Ron's younger brother went to school and lied to his teachers and friends about his brother's disease. We need to stop the judging. This can happen to any one of our families. Parents, guardians, loved ones need to start having conversations with our youth. A 5-minute uncomfortable conversation could save them. Educate yourselves. Talk about regular testing. Talk about proper condom use. Let them know they're loved. For all of you that are watching out there that may be HIV positive and have not been tested yet, please take the step to save your own life. It's simple, and remember, you are loved. In closing, I'd like to use Ron's words. Quote, "Don't put HIV testing on the back burner." Quote, "Don't ever be afraid to be protected. Get tested." And while he was alive and fighting this battle, one of his favorite quotes he would say every day is, "Only God only gives his strongest warriors his toughest battles." I want to thank ACR Health for giving me the opportunity to let people know my son's story, because that's what he wanted. Thank you.
We'd like to open up for some questions now. Any of us could answer or target questions to anybody up here?
Mayor, can you talk a little bit about the city's task force and what you've done, like who was brought together, kind of what it's done since you've got, a couple of years aligning with the state ET?
Well, we brought together everyone who we thought would come into contact with populations that needed to be educated or needed to be made aware of testing, of what was out there. So by bringing everyone together, we felt like we could cover all of the bases so that nobody, no stone, if you will, would remain unturned. So that would be obviously healthcare institutions, also housing experts, also community centers, essentially every kind of group that interacted with the public. We brought together to try to figure out, and with obviously I cannot say enough how important ACR was to this effort, to be able to communicate this message and make sure that it permeated it throughout the community. But also I want to just take this moment to say that while we did all of that, the most powerful messages that you can hear are messages from people like Denise, who talks about what it means to her family, and through her own pain shares her story so that other people within our voice will think twice and say, you know what, maybe I should get tested, maybe I should have a loved one who get tested, maybe I should have a conversation that may start off as uncomfortable, but in the long run will save people's lives. Because that's what we want to do, is we want to save people's lives and make sure that we're doing all that we can for the people in our community, that they have a good and better quality of life.
Yes.
Could you say, related to the task force, other state initiatives, there's a state AIDS institute, right?
Yeah, we're funded by New York State Department of Health AIDS Institute, yes.
Yeah. What's been successful? You talked about a 79% reduction in infections, and it's tending toward getting to that goal by 2020. What's been successful in the state of Oklahoma?
A lot of it can be the targeted testing for HIV. I mean, we have increased our testing program, how much? 45% over the last couple of years. Reaching many more people, identifying those people with HIV so they can get into treatment and be successful with their disease. This is the day now is to identify people that are HIV positive, and there is medicine that works that can keep them alive. That's pretty much it. The targeted testing, targeted programs to people at risk.
But well, the stigma's still out there, obviously, so is there any way to get past that?
Well, we try to educate. The more people you can educate, and the AIDS Walk Run has provided that money to educate youth, and it seems like the younger generations kind of wash that away because they know that they can take PrEP, they can wear a condom, they can be, with their friends and be safe, and there should be no stigma with this. But of course there still is. It does isolate, and we work very hard. Our employees work very hard with the clients that we serve to bring them out of the shadows and to really understand what they have and to work with it and to be a very active part of their community.
John, can I ask you a question since you're kind of on the front line a little bit?
Sure.
Safe sex has been taught for 30 plus years. Are there other lifestyle things you think are important to note to try to prevent infection?
Well, Will spoke just a moment ago about doing community outreach to community outreach to many different populations, and I think stigma is a huge part of that. It's what prevents people from getting tested. And at ACR, we offer a judgment-free approach, a harm reduction approach, and it's a place where injection drug users and men who have sex with men and people who engage in all kinds of behaviors can feel comfortable coming in and getting tested and learning how to engage in those behaviors in a way that reduces risk. Does that answer your question?
Sure. Just to add on that, what are some of the ideas that are out there about AIDS and sex and cultural things that are hard to change? Because it's different for different groups of people, but that's what you do.
Right. So I think the beginning of this epidemic, it was a gay-related disease, and that stigma is still around today, and that's very hard to fight. But this is a disease that can affect anyone and everyone, which is why it's so crucial for people to know their status.
We also have to talk a lot about, as the mayor recently just reminded me, about syringe exchange programs. I met with the mayor 2010, and she says, of course the city needs a syringe exchange program. It has been an extremely excellent weapon against HIV infection. I mean, injecting yourself with a needle is one of the fastest ways to get infected with HIV/AIDS, and we have slowed that down dramatically. I mean, 20 plus years ago was 40% of infection in New York State was from a needle. Now it's under 3% statewide, so it's been a tremendous success. And we're in the middle of a heroin epidemic where people are using needles more and more and more. You need a clean needle every time you inject, and that's a message we've been out and very strong with for years now, and it really works.
Denise, would you mind, could you just tell us something about your son? I mean, you're very courageous in telling us this story, but for 32 years, can you tell us something about what he was like?
He was very outgoing, very compassionate. He was the life of the party, pretty much. Had everybody laughing all the time. He unconditionally loved people. And he did not care what color skin you had. He did not care if you were, he didn't judge people. If you were a druggie, he loved you. If you were black, he loved you. If you were Puerto Rican, he loved you. He spoke 3 different languages. He was smart, intelligent. And I could not believe he allowed fear to stop him from being tested, because to me, his whole life he was brave because he didn't listen to what other people said. He walked down the street with people that other people didn't like, and he did not care what they thought. He was gay, and he did not care what you thought. He was a very good person, and I know he's here right now, or I would not be talking. And I know he's glad his story's out there because if he was here, he'd be talking.
Thank you for your courage.
Well, I'm sorry, because of the rain, I guess we're going to paint a little later, but I wanted to know this is when we paint the actual stripe down the street in Salina Street. But I want to thank everybody for coming, and please, please, please join us this Sunday at Beaver Lake Nature Center for the 25th Annual AIDS Walk Run. It's a powerful event, it's a fantastic venue, and it's really life-impacting when we can have that money and we spend it on educating our youth of today. So thank you all very much.